Yesterday was good, and today even better. The doctor, Saurabh, Joshi, and his team were super positive and interactive. The varicose veins in my legs were starting to develop and give me more and more pain. I had this for the past 5 years. And then after going through all the testimonials on your website, and I was convinced that it could be done. And I'm not sorry I did it. I'm also a breast cancer survivor, which I did in 2007, and I've been following up. There's no recurrence. I felt I was at a party in the OT. They played my favorite music and sang along, bopping their heads while doing the procedure.
Surgery needn't always be a drab sort of a sort of
Exactly,
it,
exactly. That was the really fun part of it for me.
Hello everyone, it's my pleasure to have Mrs. Torina here with us, and she's had her vena seal procedure 2 weeks back. Torina is from Kuwait, and it's a very special procedure for a very special person. Torina, welcome and thank you for agreeing to share your experience with us so that our patients come to know more about it. So Torina, can you tell me something about yourself?
Okay, I am 68 years old. I've retired just a year ago, and now we are, my husband and I are globe trotting or India trotting, and whilst we are trotting, I found that my legs, the varicose veins in my legs were starting to develop and give me more and more pain. I had this for the past 5 years, but because of my, uh, using techniques to, like, putting your legs up and whatever, I managed to keep it at bay. But I'm also a breast cancer survivor, which I did in 2007, and I've been following up. There's no recurrence. Um, nothing that has happened after that. But you are always apprehensive when you want to go into a procedure, whether it is invasive or non-invasive. So I was pretty amazed by Dr. Saurabh Joshi, because he addressed the issue and gave me confidence that this was something that can be solved. It is not a big problem, no matter whatever. I've had other issues, but vena seal was his answer, and it was non-invasive. So he convinced me that there would just be, local anesthesia, no scars, no, this formations of the legs or whatever. So I was pretty convinced that I should go for it.
So, Torina, when we were actually doing the procedure, could you share your experience, about what does the patient feel? So, when you came here in the morning, what were you expecting for the procedure? Were you thinking that now this is going to be like a surgery, or and how did it actually turn out? I mean, was there a stark difference in what you were expecting and when it actually turned out in a way?
Actually, I was pretty amazed at the way the whole procedure was handled. In fact, I wrote an excerpt of what happened, and I'd like to read it out to you.
Please.
Yeah.
Please.
So this is on the next day. I said, just recording my experience with vena seal treatment with Dr. Saurabh Joshi at the Vein Center, Mumbai, on 8th March 2023. Yesterday was good, and today even better. The doctor, Saurabh Joshi, and his team were super positive and interactive. I felt I was at a party in the OT. They played my favorite music and sang along, bopping their heads while doing the procedure, while keeping me clued onto what they were doing step by step, including how they were doing it in time and how soon we would be done. Pre and post op, you are in a room where you are prepped and observed at all times. The anesthesiologist was also a very bubbly, positive, and super interactive girl, Dr. Seema Bhagwat. Uh, I say girl, although she's 40 years old, but she came across as a girl. She was very good at her job, and as well as joining in the party mood and managing the music. All in all, it was a beautiful experience, and the two doctors and two nurses as well as the anesthesiologist made it a fantastic, unforgettable event. The doctor, before your discharge, meets you in his office to brief on your aftercare and meds and takes you through the whole procedure on video record. I now go back to him for follow up after a week. I will keep you posted on my progress.
So, Torina, now it is like 2 weeks post your procedure. Can you tell us the difference in the feeling in your legs from before to now?
To tell you the truth, I am amazed. I think I am healed. I never expected the healing to be so quick and so perfect. I have no swelling, I have no pain, I have very little scars, which, of course, 2 weeks down, you expect to have some kind of a trauma. I had a little bit of what would you say?
Inflammation.
Which, after contacting the doctor, he told me how to treat it and put me on medication that took away that inflammation and I have healed. There's just like maybe 5% of that inflammation left on the leg. So I came now and I had a follow-up procedure with the doctor again after 2 weeks. And he says, I'm good to go. I probably can run a marathon in a month.
Of course. You can run a marathon, you can do, whatever you want to do. And it's so very satisfying, Torina, to see your progress. Because, I'd seen your legs 2 weeks ago and the swelling was like, it was, and what I'm seeing right now is amazing. It's like crazy to see it. It doesn't even look like you had anything, amazing. It's so satisfying just to see that, and especially from your past history and knowing there can be multiple reasons for the swelling, and seeing you recover so well is really, this is why we do what we do. And
but I think this is a two-way street, because it's your interaction with the patient, your confidence level of I will make you better. I am there. I am guaranteeing you that you will. And then after going through all the testimonials on your website, and I was convinced that it could be done. And I'm not sorry I did it.
No, it is, it is very satisfying again to see your progress. And this is, you were very jovial in the OT as well. It's really, again, like you said, it's a two-way street. And it is fun to operate to your favorite music, and if your favorite music happens to be the same as my favorite music,
which happened to be,
so that it's more of a, it's
correct.
Which a surgery needn't always be a drab sort of a sore
exactly,
affair.
Exactly. That was the really fun part of it for me. So I think you should continue to do what you're doing, and people will definitely come to you, and get well in no time.
Thank you, Torina. Thank you for thank you for sharing your experience, and you are going to keep getting better with time. And I look forward to seeing you 2 months down the line, to maybe taking a follow-up interview then, to to sort of compare how you got better further. Well, thank you, Torina. It was amazing having you over.
Thank you, doctor.
Thank you.
This has been a very good experience for me.
Thank you.
And I recommend people all of you, do the venous seal procedure, but do it with Dr. Saurabh Joshi.
Thank you. Thank you.